So, what, in your opinion, what are the current challenges facing the healthcare industry and in Asia?
The problem in Asia is to provide, well, first of all, the challenges are different from one country to another. There's no relationship really between Singapore, for example, and Vietnam or Cambodia. Thailand is a different animal as well. They're all different. So I'm a specialist of Vietnam because I've been here for 19 years and I run the FV hospital since we opened in 2003. So I think my answers should be focusing on Vietnam. Everything else I don't really know. In Vietnam, the main challenge is to provide quality healthcare for the large number. Quality healthcare is expensive. So the problem is to provide a way to finance for patients good quality care. So the answer is probably mutualization, insurance. Could be an insurance provided by the states, but the state is not rich enough to provide enough money. So it has to be complemented by private insurances. And this is, in my view, the main challenge that the healthcare sector is facing at the moment in Vietnam is to raise the quality by raising the way we can finance it. Because anything else, unfortunately, quality has a cost, and we cannot decrease that cost. We can, but it's very limited. The second challenge would be to increase the number of professionals. There is not enough doctors and nurses in Vietnam. This is also true in other countries like Cambodia or Laos. But in Vietnam, where you have 93 million people, you will need far more doctors that they have at the moment in the country. And the third challenge would be to provide a good level of medical care outside the big cities. Because in Vietnam, most hospitals, almost all the good hospitals are concentrated in 3 or 4 cities. Ho Chi Minh City, Hanoi, Da Nang a little bit, Can Tho a little bit, and that's it. So and a lot of people live in the countryside. So they don't have access to quality healthcare unless they come to the big cities, which is a lot of time and money, to do that. So I think these, in my view, are the three main challenges facing Vietnam today.
It's very interesting because this is not the first time I hear this. I heard it before. So how do you think, or what do you think can tackle these challenges? What could help tackle these challenges?
Um, when it comes to the number of doctors and nurses and good quality, high quality education for them, I think the answer lies in private universities. Universities like the big American one, the name escapes me now, but they open universities around the world, and they have opened medical universities in Thailand. Yeah, good training. Yeah, this is very important. But yeah, it's also a decision by the government to help fund, organize. It's a lot of things to do. I think this is not something we can do us hospital providers. Even though we can help by welcoming young doctors and help them to be trained, but that's about what we can do. For the third challenge, I think the answer would be to have mostly private facilities opening subsidiaries in the countryside. It's something we are thinking about doing ourselves. For the first challenge, it's a very complicated one because insurance companies, they hesitate to give high ceilings because not enough people can afford it. And the end result, the consequence of that is because their level of reimbursement is low. So actually the problem at the moment is local insurance companies are pushing quality lower because they don't want to spend money. And that's a big problem. It's almost unethical. And we are at the moment having discussions, and I think those discussions should be at the political level because there are issues here that we cannot, as hospital providers, solve. So again, it's a complicated challenges because they involve a lot of actors, and there must be a political will if those things will change.
So I can assume that these are also the main challenges for FV hospitals.
Well, EVI has different challenges, of course. Now, EVI is not established name. We've been accredited in this year by JCI. We've been working a lot for that. It's been quite difficult, but we are very happy to have achieved that. Our challenges are the development. We want to develop what we call centers of excellence, new activities or going deeper in some activities we have already done. For example, we are about to launch a liver cancer unit, which requires a lot of equipment and professionals highly competent to deal with liver cancer. And we're about to do other things as well. So these are the challenges are very special to AV as a hospital, as an entity. Other challenges is to attract the best doctors. We're happy because recently we have attracted a few very top doctors, and this is what we want to have. We want to attract the best Vietnamese doctors because we offer, I think, a very nice platform, good facility, good equipment, and a modern way of functioning. So that I think this is appealing to a number of doctors. This has been a long-term goal, and it will be always a long-term goal, and for nurses as well. But we are welcoming young nurses from the university that we train ourselves, and then we keep about 25% of them. So that's also a very good way of doing because we take them young, we teach them how to do really things in a very modern way, and when they're good, we keep them because they don't want to go elsewhere. Yeah. These are the challenges we're facing.
Do you have also hospitals in other provinces as well?
No, we have only the one hospital, AV Hospital, which is in District 7. We also have a clinic in District 1, very close to here. But what we want to do is opening clinics in the countryside, like Mui Ne, Vung Tau, Phu Quoc, Can Tho, Trau Doc, or places like that. I think it would be very good to do.
So all over Ho Chi Minh.
And we are in the south of Vietnam. No, not around Ho Chi Minh because it's too close. No, a little bit. So it's a little bit complicated to do. We need partners. We need to have logistical issues to solve because it's not easy to organize a network. But this is something we want to do.
That's great. Do you, what industry trends do you see in the future?
I think in Vietnam again. I think in Vietnam you will have big actors coming. Already, it happened. When Fortis purchased One Me, and then Fortis sold it to Chandler. I think people are interested into Vietnam because they see it as a very promising market, and it's under-equipped. And when it comes to big companies like Ramsay or whatever, well, they're not very present in Vietnam, almost nothing. On the contrary, in Indonesia, in Thailand, in Malaysia, you have lots of prominent companies. So Vietnam is a new market. I think this is going to happen, that new companies you're going to see merger and acquisitions, and new resources being poured into the country.
Okay. How have HMA, have you met your objectives in HMA? It's what I'm trying to say.
Not yet. This is the first day.
Okay.
Yeah, I'm a regular in HMA. I've been coming at the HMA first as a guest, I don't know how you say, and then as a speaker for something like 14 years now. And I'm actually speaking tomorrow. My objective is not to learn anymore anything. Well, I can still learn. I'm very happy to meet people, but it's for my team. That's why I have about 25 people here from my team that I sent to all those workshops, and it's very important for them to see, to learn, to listen, to see the way is being done elsewhere in other countries. And it's very often eye-opening. I must say that I got a number of ideas where in each HMA I was like, oh, that's good. I'm going to do that, many times.
That's good to know. You've taken ideas from sessions or from talking to people.
Mostly sessions,
Mostly sessions.
because during a session somebody explained a topic very, in a detailed way, so you understand better what they want to do, or the way they wanted to do, or what they have achieved, and you're thinking about, could I do that in my hospital? Maybe I could modify that. And this is a better way. Speaking to people, it's very often a little bit too superficial. You don't have time to really grasp the details. So.
It's true, yeah, it's true. Well, you've been around for a while, so I can ask you, what is the thing that you like the most about Hospital Management Asia, both the conference and the awards?
Oh, what I like the most? Well, it's very, very, very nice for me to meet people I know, because we don't have the opportunity to travel to other countries every day. So during those 2 days, I meet a lot of people from Philippines, from Thailand, from Singapore, a lot of friends, people that I don't see very often. I've been working with them or met them or whatever, but it's very pleasant to see them. And the second thing, that it was very much the reason why I attended HMA in the past, was to attend sessions, particularly some topics. And now it's a little bit less of my it's still very interesting, but I don't feel the need as much as I felt it in the past. So my main pleasure, I could say, is to meet all those people. And networking, as you know. Yeah, and I know a lot of them.
Yeah. In 14 years, I bet so. Okay, well,